Zach, if you want to do a quick sound check.
Yeah, can you hear me?
Yep.
Okay,
All right, I'm going to put myself back on mute.
very good.
And I can see you. Good job.
Excellent. Okay, good afternoon, everyone. It is 2:30, so we will get started. Thank you for joining us for this media briefing about COVID-19 vaccine in Idaho. My name is Zachary Clark, and I am moderating the briefing today. A reminder that ASL interpretation is available. Search for the window for interpreter stubs and hover over the three little dots to the right in the video window to lock the screen in place. For the briefing today, we'll be hearing from Health and Welfare Director Dave Jeppesen and Public Health Administrator Elke Shaw-Tulloch before we open it up for vaccine-related questions from media. Our State Epidemiologist Dr. Hahn and Idaho Immunization Program Manager Sarah Leeds also will participate in the briefing. We will not be taking questions from the public today. Please note that everyone should be muted unless they are speaking. And with that, I will turn it over to Director Jeppesen.
Thank you, Zachary. Let me get myself off mute here. Well, welcome everyone to our weekly press briefing about the COVID vaccination process in Idaho. We continue to see great progress with COVID-19 vaccinations across the state. Over 500,000 doses have now been administered. Idaho is now receiving just a little over 50,000 first doses a week of Moderna and Pfizer. And this week we are receiving about 2,500 Johnson & Johnson doses. Also, just over 60% of those 65 and older have had at least one shot now. And Idaho is doing quite well with second doses being administered. In recently released CDC data, 93.1% of Idahoans who had a first dose received their second dose within the recommended time frame. That is well above the national average of 88%. And puts Idaho in the top 10 best states in the country for second doses occurring at the right time. The data also indicates that only 2% of Idahoans have missed their second doses, compared to 3.4% nationally. And 4.9% of Idahoans are within the time window to get their second dose, but have not done so yet. And we assume the vast majority of them are scheduled to do so. And that's compared to a number of 8.6% nationally. A quick update on the statewide vaccine pre-registration solution. About 75,000 Idahoans have registered. About 8,500 currently are in an eligibility priority group, and they've had an enrolled COVID-19 provider indicate that they plan to schedule them or have scheduled them already. And of those 8,500 being scheduled, about 2,200 are over 65. As a reminder, those 55 to 64 who have at least one underlying health condition became eligible for vaccine yesterday. Those are the only two qualifications needed to be eligible in this priority group. And all those 55 to 64, again, all of those 55 to 64 are eligible for the COVID-19 vaccine on Monday, March 22nd. Again, that is the only qualification needed to be eligible in this priority group. And all previously eligible priority groups remain eligible. Finally, just a reminder to continue to wear a mask and physically distance and to stay home when you're sick. And with that, I will hand it over to Elke.
Great. Thank you very much, Director. Today I have a few things I wanted to cover with you. And I'm going to start by talking about our COVID-19 Vaccine Advisory Committee. And the Director shared some of this information just a minute ago. But just as a reminder, our COVID-19 Vaccine Advisory Committee, or CVAC, provides recommendations to the department and to the governor on prioritizations of populations to be vaccinated when the vaccine supply is limited. So as the Director mentioned, and as we mentioned last week, CVAC determined that Idaho Group 3 would include people aged 55 to 64 for 2 weeks with the first dose for people with medical conditions, followed by people aged 45 to 54 for 2 weeks, the first week for people with medical conditions, just as the Director just mentioned. I want to also state that CVAC also determined that the remaining essential workers that we were evaluating to be in Group 3 would not be prioritized in Group 3 separately, that they would be vaccinated in the age group in which they belong. And since last week, CVAC conducted an online vote to look at what would come next. So their online vote determined the priority populations that would be eligible after the population groups that I just mentioned. They determined, with a 24-6 vote and 1 abstention, that the next priority population groups would be people aged 16 to 44 with medical conditions putting them at risk for severe COVID, followed by the general public age 16 to 44. This vote concluded on Monday morning, and the recommendation from CVAC was brought to the governor Monday afternoon. And the governor accepted CVAC's recommendations and determined that people aged 16 to 44 with medical conditions would be eligible on April 12th, and and then the general public ages 16 to 44 would be eligible on April 26th. So this means that before May 1st, all Idahoans will be eligible for vaccines. We're very excited about this opportunity and this schedule. And CVAC will be meeting again this Friday, March 19th from 12 to 2 to review those recommendations that were approved by the governor, continue on with sort of our normal updates that we receive, and have some additional conversations. I have a few other topics related to vaccine that I wanted to bring up. And as the director had said, of course, we're seeing some really, the Johnson & Johnson, the Janssen vaccine appears to be rolling out well across the state, and we're looking forward to that supply picking up. For the coming weeks, the amounts that we will be receiving is still uncertain at this time. We know that there is likely some more vaccine becoming available, but we don't know exactly that amount currently. I also wanted to mention, I know it's been in the news a lot recently, is around the AstraZeneca vaccine. And we are closely following the progress and issues related to the AstraZeneca vaccine and the reports over small numbers of patients developing blood clots, and that several European countries have halted its use. I just wanted to make a note here that, just as a reminder, this AstraZeneca vaccine is not authorized currently in the United States, but we are keeping our eye on it. The last thing I wanted to bring up is that we have heard that anecdotally that some vaccine providers may be charging for COVID-19 vaccines. We want to make sure today that it's very clear that no one receiving a vaccine should be charged for that vaccine or its administrative costs. The vaccines are completely free to the patient. The provider may charge the patient's insurance for the administrative fee, and people without health insurance or whose insurance does not provide coverage for the vaccine administration costs, those providers can receive, they can still receive the COVID-19 vaccine for free, but those providers administering the vaccine, the people without health insurance or whose insurance does not provide coverage of the vaccine administration, can request this reimbursement through the Health Resources and Service Administration, or HRSA, Provider Relief Fund. So just again, in summary, vaccines are provided to the patient or the person receiving the vaccine completely free to that person. So to wrap up with our brief comments today, I just want to end by saying that we have, I'm going to reiterate this from last week, that we've made some amazing progress with our cases and our vaccine administration across the state, but it is very imperative that we continue to take precautions. I want to remind people that for a lot of the state, next week is spring break, but it's not the time to let our guard down. We're very concerned that people will use this opportunity to gather in large groups, unmasked, and completely let their guard down. And if we recall, last year we did have significant increases in cases after spring break. So we really want to see that our amazing work in the state and our continued progress does just that. It continues. The progress continues. So we are really imploring everyone to please do your part to limit the transmission of COVID while we get the vaccine out to as many people as possible. And with that, Zach, I'll turn it back over to you.
Thank you. So we will now take vaccine-related questions from media participants. We will answer as many questions as possible in the time available. Please raise your hand in WebEx by selecting the hand icon in the lower right portion of your screen, and also type your question into the chat area, which you can access in the lower right part of your screen. When I say your name, please unmute yourself and announce your name and media outlet before asking your question, and remember to clear your hand when you're done. So first question, first up we have Selena Van Heining.
Hi there. So my question is about the no waste wait lists that have been coming up around pharmacies and providers around Idaho. So there's a lot of them around the valley, obviously, and it kind of seems as though cancellation of appointments and vaccine hesitancy is causing doses to go unused. So my question is, why is the department deciding to not just make everybody eligible right now?
Yeah, thank you, Selena. We have several folks who can all chime in on this, but I'll start by saying that, just because you see something in the Treasure Valley does not necessarily mean that you're seeing the same experience in other parts of the state. We want to make sure that as we are rolling out vaccine across the state, that we're being as equitable as possible. So we are also at the same time trying to make sure that we're keeping the pace up. There are parts of the state that have been, needing to go a little bit faster than others, and so we're trying to be respectful of that and make sure that we really keep those the supply and the demand as balanced as possible across the state. And your question was around those no waste wait lists, and certainly I think that we want to make sure that there isn't any waste of the vaccine. So we're happy that providers are having those lists available, because as we come to the end of the day for some of those vaccines that are set to expire at the end of the day, we want to be able to make sure that we get those vaccines into the people as soon as possible. And I'll turn it over to Sarah and see if she has anything else that she would like to add.
Yeah, no, I think you summarized it really well, Elke. I've got nothing to add.
Thanks.
And Elke, I'll add a quick comment there too. Just on the prior, we did see a decrease in demand for vaccine appointments as we got about a week or so ago with the 65 and older group, which is why we accelerated opening up group 2.3 and to make sure that we still had a match between demand and supply, which is also why we accelerated opening up to 55 to 64 as well. And so we do know that those that have underlying health conditions and those that are older are at much higher risk of severe disease and hospitalization. And so rather than overwhelm all of our provider systems with hundreds of thousands of people at once, we really wanted to accelerate those groups that are at the highest risk. And so as you can tell, we now have a schedule that's quite aggressive that gets us from here to the end of April through those hundreds of thousands of folks. And really we're opening up to 200,000 or more every 2 weeks now as we move forward, which should be enough demand to match up against that supply and minimize the number of vacant appointments out there.
Okay, next up we have Hayat Noramine.
Hi, thank you. So I just wanted to clarify, so the 16 and older with underlying health conditions, so that makes them eligible by April 12th, is that right? And then anyone 16 and older would be eligible by April 19th. And then I do have a follow-up question.
Yes, thank you. So just to clarify, people aged 16 to 44 with medical conditions will be eligible on April 12th. And then the general public ages 16 to 44 will be eligible April 26th, so 2 weeks later.
Okay. Thank you. And then I did have a question. There was some confusion around some notices that people have been getting on, they enrolled to pre-registered for the vaccine, and then they received notice that that someone had tried to contact them and weren't able to get through to them, and they didn't receive any notice from a vaccine provider, and they were told that they were back on the waiting list. I'm wondering if you can explain what happened there.
Thank you. That I will turn it over either to the director or Sarah. I'm not familiar with that situation happening. I hadn't heard that.
I can take that, or director, if you want to.
Go ahead, Sarah.
Okay, sure. So that is something it's relatively standard for this system. So what is probably happening is that a provider is pulling down a list of people to go through for a certain number of doses they may have on hand, and then that process will activate an email to tell that person that they've been removed from the list and they're now, kind of in about to be contacted. But then if the provider fills those appointments, say they've pulled 15 but only have 10 doses, once they've filled those appointments, that person can go back on the list. And so that is what I've heard. People are getting those emails. So it's not to be alarmed. There's nothing going wrong with the system. It's the system working. So when a provider pulls a certain number of patients or people from the list down to call them, and then they don't have any available doses left, they've filled those, then the patient goes back on the list.
And I know someone who had just received a vaccine appointment, has an underlying health condition, and but is not in those age groups that are currently eligible. I'm wondering why that is. This person is in their 20s. It just seems a little arbitrary, given that this eligibility won't be open until April.
Yeah, I think, of course, let the director and Sarah weigh in if they'd like. But certainly, as we've said repeatedly, I think every week we have make some comment about the fact that this is not a perfect system. And we have providers across the state that are really trying to make some decisions on the ground as well. We have eligibility categories. There are people that are very, very anxious to get the vaccine. Finding ways to make that happen, getting on wait lists or end of day appointments. So there's a variety of reasons why some of that may occur. I think the bottom line philosophy that we're all shooting for is that we want everyone to get the vaccine who wants a vaccine in Idaho. And then, of course, we also want to make sure that we have equity, that we have fairness across the state, that we're trying to adhere as closely as we can to priority groups. But there are certainly going to be situations where a provider may allow someone that's not in the current eligibility group to come in and get a vaccine. And while we would hope that everybody could stick to the plan, we're also glad that someone is getting a vaccine that wants a vaccine.
Okay, next question will be from Joe Paris.
Thanks. I know as we passed the 1-year anniversary of the first confirmed case of COVID, we've had a lot of questions about when can we return to normal? And I know a big conversation on these calls for weeks has been about herd immunity. And I'm curious, I've got a few herd immunity thoughts here. Between the people who've already had COVID and people who are eligible and working to get the vaccine, is it possible to reach a meaningful level of herd immunity through that way? And is there any way to compare this to the flu for people at home? Do we ever get herd immunity to something like the flu during flu season? And is that something that medical providers worry about, or is it kind of just get as many people the flu shot as possible and see what happens from there?
Thanks, Joe. I'm going to ask Dr. Hahn to reply to that one.
Yeah, Joe, that's a really good question, and that we have been thinking about this and talking about this quite a bit lately. You have a couple questions. So let me start with the first one, which is when can we start getting back to normal? When do we think we'll be at herd immunity? The governor has actually asked us to help create a sort of a set of metrics to really think about what indicators would we want to be able to start moving back towards a sense of normalcy. And we are actually in the process of working on that right now. We know that it's not in the next few weeks, so we have a little time, we think, but we do need to have something, a kind of a blueprint. And our epidemiology team is actually working on that now. We've met about it just a few days ago to kind of hammer out some ideas, and I think we're headed in a good direction. As you can imagine, it will include things like the number of folks that have gotten vaccinated, the number of cases and the number of folks in the hospital, those kinds of things. But we hope to have something to show the governor in the next few weeks about that. Regarding flu, that's a great question. So the short answer is no, we never reach herd immunity for influenza really in a flu season. We suspect, as we have bad flu seasons and not so bad, not as severe flu seasons, but generally it's estimated that maybe 15 to 20% of the population might get the flu every season. And we know that immunity is not long lasting for the flu. You know, that's why we end up with the annual flu shot. Not only is it not a good long lasting immunity, but of course the virus mutates rapidly enough that the immunity you have isn't going to help you as much in future years. So flu in some ways is a great model for COVID. We've talked about it a lot. You can make a lot of comparisons, but unfortunately it doesn't provide us much of a window for herd immunity. I think we've talked about this in previous weeks, but we haven't really heard any new scientific data that would change the somewhat moving target of around 80-85% that we've been hearing lately. Now that said, that doesn't necessarily mean that 80 to 85% of us need to be immunized. We know that a certain percent of the population may have gotten some long-term immunity from having been naturally infected. And we know from our Red Cross blood donor data that we get regularly that about 25% of Idahoan blood donors, which is not a random sample, and it's all adults generally, but about 25% of them have some antibodies detectable. So we know there's a significant amount of natural immunity in the population, but that's not what we can rely on because we just don't know how long that will last.
And a quick follow-up to that, I've heard a collection of anecdotal cases of vaccine hesitancy or people that don't trust the science for whatever reason. Is there any data on your end that would show that vaccine hesitancy is, I guess, making herd immunity or, I guess, a meaningful amount of people getting the vaccine in Idaho unachievable? Or is there optimism that enough of the population will get the vaccine to make a difference?
Yeah, Joe, that's another thing we've been, of course, thinking about, talking about a lot. I would say we remain optimistic. We know there are people that even a few months ago were hesitant about the vaccine. It's a brand new vaccine. It was developed more quickly than, by far than what we usually see. But we know some of those folks are saying, hey, I'm starting to get more confidence. Time has gone by. People have been vaccinated since December. And they seem to be doing well. We're not hearing about any new, in the United States vaccines, we're not hearing about any new problems or unexpected problems, just the concerns that are still bearing out about an occasional allergic type reaction. So we're hopeful still that we have a lot of folks out there that might have said, I'm going to wait and see, that we might be able to show enough evidence too that they do decide to get vaccinated. And of course, there's the whole group of children that we are waiting to see those trials go forth and get completed so that we can see about whether children may someday be immunized at the same rate, and hope, as adults, we'll see. So I would say we're still optimistic. But we're very mindful that there are folks that we need to keep showing information to and data to, and time needs to pass before some people are going to be comfortable.
Thank you so much.
Sure.
Okay, next up we have Kyle Fahnensteel.
Thanks. This is Kyle Fahnensteel with the Post Register. I wanted to ask about the decision to include people age 16 and up. There's only one vaccine approved for them. I guess I'm trying to wrap my head around what this is going to look like. Is the state going to be providing a list of providers who give out the Pfizer vaccine, which is approved for use in people age 16 to 18? Or are parents going to have to shop around individually for a site that gives out that vaccine?
Yeah, thanks, Kyle. I think both. I think the state, through our pre-registration tool, we do have the ability to capture, the age groups, of course, and then we can maybe update that. We can do that. Update the pre-registration tool so it has that feature to then be able to notify a provider, excuse me, of that age grouping, and then be able to match that age grouping with providers that have the Pfizer vaccine. So I guess some technology that we can employ. And then also, of course, it's the child and parent's choice about getting the vaccine for certain. And then just we really want to work with our providers to help make it known what vaccines they are giving out. So then it makes it easier for people who are age 16 and 17 to be able to find a provider that's best suited to them.
Thanks.
Okay, next we have Nicole Camarda.
Hi there. My question is for Elke. We've been getting a lot of confusion just about how these priority groups were broken down when it comes to before, when group 3, one of the considerations was, people in legal, media, public health, etc. But now, is it just, sorry again for the repetitiveness, but is it just going to be age and health condition broken down? As far as here on out, it's not going to be anything to do with their occupation, correct?
That is correct. And I'm glad you brought it up because I think it's important. I try to address that a little bit in the beginning, but yes, to make it very clear, when we were looking at group 3 originally, and I know that all of our meetings have been open to the public, we were looking at an age grouping plus all of those remaining essential workers. But the new votes and the new way this will be moving forward is all age and age plus medical condition based from here on out.
Great, thank you so much.
Mm-hmm.
Okay, next is Melissa Davlin.
Thank you so much, Zachary. This is Melissa Davlin with Idaho Public Television. I am looking at the map for vaccination rates by county of residence, and I had asked previously about disparities in those rates county by county early on in the process. And now that we've had a few weeks of vaccines being open to the general public, ages 65 and older, if anything, we're seeing those vaccination rate disparities grow, with Owyhee County having only 12% of residents vaccinated, while Blaine County is at 37%. I was wondering if the department or the health districts were looking into the reasons for those disparities. Is it as simple as demand, or are there fewer providers and pharmacies per capita? What is the department seeing there?
Well, I'll start it, and then Director, please feel free to chime in. But certainly you've seen most of this to this particular point in time has been, driven by healthcare personnel, long-term care facility, and staff. Those were our first groupings, and then we got into I said the frontline essential workers and people over age 65. So it's been pretty specific in terms of where we were allocating vaccine or what population groups we're allocating those vaccines to. So it has been demand driven based upon a lot of the occupational areas and age group in the older age population. So certainly we are working with the local public health districts. We're working with our internal team here as well and our communications staff to really start focusing on how do we really make sure and I talked about this last week too, making sure that we're looking at where those disparities exist. How do we reach those hard to reach populations? What's the modality that we'll use for doing those vaccines, whether that's a mobile van, whether that's a strike team that goes out and provides those vaccinations. So I think you're going to start seeing more of a shift, and hopefully we're acutely aware of those situations and overlaying that with the social vulnerability index, the CDC social vulnerability index, to make sure that we're also, we're taking everything we can into consideration. So a point well taken, and certainly very, very high on our priority list and our radar, and driving the work that we're doing moving forward. And Director, do you have anything you want to add?
It's a great question, Melissa. We've actually taken a look at the data to see if there's any patterns in there as to why some counties, particularly rural counties, have lower vaccination rates and why some counties have a higher vaccination rate. And it does not appear to be a pattern based on number of providers that are available or any of those things that we thought it might be. So we still don't know exactly why that's happening, other than there's probably some demand differences there. But we have counties with very few to no vaccine providers that are doing quite well, and some counties that have very few that are struggling. And so we're still kind of digging into what's driving that vast difference between the counties. But our goal is to make sure that anyone that wants the vaccine, whether you're a rural county or not, and even between rural counties, is that you have the opportunity to do so. And particularly as we now have shifted to these age and health bands that will allow us to shift our attention to really understand how are we going to close the gap in those counties that seem to be behind. And so that'll be a focus of ours over the next coming weeks, is to make sure that particularly in those counties that seem to be lagging behind, how we can help solve that and make sure that that vaccine is available to those that want it.
Thank you so much, Director. And Elke, just a quick follow-up question. Elke, you had mentioned mobile strike teams, or I didn't mean to sound militaristic, but mobile units or focused vaccination efforts. Can you give us an update on potential mobile vaccination efforts like that? Is that something we're going to see soon?
I think we're already seeing that in some areas. So I'm going to actually let Dr. Hahn, who's been doing some volunteer work, describe some of her experience as well. But we are seeing some of that happening here in the Treasure Valley. I know that some of the local health districts have talked about that. We have now access to FEMA funds that can help support some of those efforts. So definitely it's underway. But I'd like Dr. Hahn, if she's willing, to give her some of her experience on that.
Yeah, thank you, Elke. I'll just quickly mention that at the advisory committee meeting this Friday, we are hoping to have 2 presentations on mobile clinics, so please tune in to hear that. I'll just quickly mention that I have gone to 3 clinics in the last week with the Family Medicine Residency of Idaho. They're a federally qualified health center, and they have a mobile van that they've had for initially things like HIV testing and services, and they are deploying it now for vaccine clinics. And I was at 3 different homeless shelters in the last week with them, providing vaccination to folks in the various shelters in the Boise area. And it was very rewarding and worked really well. And that's one reason we want to. And I know St. Al's is the other entity we're aware is. I'm sure there are others. I don't mean to not talk about. I'm sure there are other efforts out there, but those are the 2 we're most familiar with. And they will be speaking on Friday about. We really want to promote this idea of getting the vaccine to the people, is the way we think of it, because there are people who aren't going to show up at a doctor's office or even at a mass vaccination clinic. You really have to try to bring the vaccine to them, which I know you are all aware.
Thank you.
Next, we'll go back to Selena Van Heining.
Hi again. So I just had a question about the age grouping. So it's great that 16 and 17-year-olds are going to have access to the Pfizer vaccine, but I was just curious, are 16 and 17-year-olds going to need parent permission in order to get vaccinated? And if they do, is there going to be options for 16 and 17-year-olds whose parents maybe don't want them to get vaccinated, but they themselves want the vaccine?
Well, I'm certainly going to let Sarah weigh in on this as well from the program's perspective. But there are, certainly it's a decision that needs to be made between the person receiving the vaccine and their provider, and of course, and in consultation with their parents. But I'm going to let Sarah weigh in on her experience, especially with even just the regular pediatric vaccines and how they address those.
Yeah, it's not a topic that comes up super frequently, but there are some laws about consent for healthcare that providers do need to comply with, and we certainly, as a program, support that. But we do want to work with providers for whatever vaccine is available for 16 and 17-year-olds to ensure that those who do and those whose parents choose vaccination for their child or children have access to the vaccine right now, which is, like you said, Pfizer. So we will work with providers to ensure they have that and support their decisions, their clinical decisions.
Thank you.
Okay, and what appears to be our last question, we'll go back to Kyle Fahnensteel.
I guess before I get to my question, I wanted to clarify. So, do parents have to approve a vaccine for their children for 16 to 17-year-olds? Is there any mechanism for kids who want vaccines, but the parents don't want them? Is there any mechanism for them to get it?
Sarah, go ahead.
Sure. So it is my understanding, and I guess I would maybe ask also Dr. Hahn to confirm this, that there's an age of consent for medical care that is 14, but that is, again, the provider at the provider level for a consent for healthcare. We do know of cases where a child has accessed a vaccine when their parent did not give consent. The child wanted the vaccine, and that again is a decision between a healthcare provider and the patient. But I believe the age of consent is 14 in Idaho.
Sarah, this is Dr. Hahn. Yeah, Kyle, that is a really important question. And I think Sarah, I believe she's giving the correct answer, but I would ask that we go back and make sure we're correct about that one. We don't want to give out any incorrect information. So as we move closer to, we have another month, but as we get closer, clearly we need to get good messages out, and ideally we do want, of course, parents involved and parents to approve and all that. But in the rare circumstance where that's not possible, we need to have a very clear answer for that. So I ask you to give us a little time, make sure we get this answer exactly right for you.
Thank you, Dr. Hahn.
Sure.
And then I guess for my original question, so all Idaho adults, everyone age 16 and up, will be eligible for the vaccine by the end of April. When can everyone over the age of 16 who wants a shot, when can they access it?
Meaning the supply is sufficient for the demand? I mean, everyone in the state will be eligible by April 26th. So essentially, once we get to that age grouping of 16 to 44 for the general population, that essentially is opening up to the entire state, to all populations.
Yeah, but I'm wondering, like, when can, if I'm 16, when can I actually get a shot?
If you have a medical condition, you'll be eligible on April 12th. And if you are 16 and you do not have a medical condition, you would be eligible as soon as April 26th. Is that answering your question?
Not quite, sorry, I don't want to take up time.
Okay, Kyle, we can follow up with you after the meeting too. If you have any further questions, it looks like a couple more just came through. Joey Prechtel.
Hi, yes. My question is about the supply coming into the state of Idaho. I heard at the very beginning of the meeting, I believe I heard it correctly, 50,000 first doses coming in on a weekly basis. Just wanted to get a feel from you all and how you guys feel about that supply, because it feels to some of our viewers that certain providers, it seems that they're swimming in supply. They have so much vaccine, and that's why they have these no waste lists, because appointments just aren't being filled, not even being canceled or no-shows, just appointments not even going filled. And then we have other providers here in Ada County, at least, that need more supply, and their appointments are being filled immediately. How can you guys kind of address how that supply goes, especially with the pharmacies? I know that's from a different program. Is there any talk on trying to redirect some of the pharmacies' vaccine supplies to maybe some of the other providers that are quickly filling those appointments and getting those shots into people's arms?
Yeah, we certainly have those conversations all of the time, and as we're seeing demand change over time compared to the supply, we need to constantly have those conversations. And so we want to make sure right now, as you know, the vaccine is delivered out to the local communities based upon the population in those communities. So in some areas of the state, you have a population that may not have as high of uptake of the vaccine as in others, and so we want to make sure we have those continual touch points or that quality assurance piece going on with the local health districts and providers to start thinking about, do we need to allocate so much to this area to the state if the demand is so significantly less than another part of the state? So we meet multiple times throughout the week to have these conversations. But in terms of the rest of your question about the federal pharmacy programs, the retail pharmacy programs, I'm going to ask Sarah to round this question out, or the answer out, but I do not believe, unless we give specific permission, that they can just move their vaccine allocation. That's all done at the federal level. We don't tell them how much to send to each of those retail pharmacy partners. So, but we have had situations where we've been working with them when they might have more vaccine available than they have appointments available. Instead of redirecting so far, we've been able to just do some pushes through the local health district and through social media to get those vaccine appointments filled. But I'll have Sarah weigh in on how much flexibility there is to move that vaccine around.
Yeah, thank you, Elke. So we don't have control per se over that federal retail pharmacy partnership program. It is a collaborative relationship that we have with each of those corporations that are getting vaccine in Idaho. So it's Walmart, Walgreens, Albertsons, and the Cardinal pharmacies. And so we communicate with their staff at the corporate level on where we might need to move vaccine within their organization, but I would say there's less control about moving it away from their corporation and stores to, say, a private provider, and moving it to, a hospital or a pediatric, or, well, it would be a pediatric clinic at this point, but a family practice clinic or something like that. There's less control that we have, but it is an ongoing conversation that we have with both weekly meetings with CDC, and also we have good communication with each of those corporations and their representatives, and can talk through challenges.
Quick follow-up. So how do you all feel about the supply coming into the state? Do you guys still feel that Idaho needs more on an ongoing basis, or that where we're at now is a good level since we do have these no waste lists?
Director, do you want to take this one? You can spread the wealth of response.
Sure. I think we still have more demand than supply. And so, and we also believe that we have more capacity within the state to administer more doses. And so we would actually welcome more supply. We are getting some signaling that supply will increase. Obviously, when the Johnson & Johnson vaccine moves into full production, that will increase our supply. And so what we're really focused on is making sure as that supply increases, that we in Idaho are prepared to administer those doses as quickly as possible. And yes, we would welcome more supply into the state. Originally, we thought we wouldn't get to the open up to everyone until end of summer. We're now talking about the end of April, which is a significant change. And frankly, we'd love to have it be sooner than that. And so if we get more doses, we would look at our current plan and adjust that so we have enough demand and get those out to individuals. So yes, we would welcome more supply. And again, our job is really to make sure that when if we have more supply, that the state's ready to deliver it as soon as it gets here.
And then just one more very quick follow-up on the vaccine provider transparency dashboard. When looking at what doses have been administered and distributed to the pharmacies, when it talks about Albertsons, Walgreens, Walmart, CVS, those are statewide. That's not just to one region, correct? Those are the statewide numbers for those corporations?
That is correct.
Yes, that is correct. Those are part of that. That's the statewide numbers for those entities.
Okay, we have one more question that came in on the chat. This is from Karen Bosick. She writes, last I checked, Idaho lagged behind the national average in 65 and older folks getting vaccinated. Is there any concern they're not stepping up for it?
Director, I believe you touched base on that in your opening remarks, if you wanted to reiterate.
Yeah, I think that's a great question. We now have a lot of supply coming in the state, but if you recall, just a few short weeks ago, we were in a situation where we had not enough supply versus the demand we had in the 65 and older group. And so I think that's impacted our pace at 65 and older getting vaccinated. We do note that we are just, I think, a percentage point or two behind the national average for 65 and older. But we do see them continuing to still get vaccinated. And we will continue to support them and encourage them if they want to get vaccinated to do so. So yes, I think that was a function of where we were with supply versus demand for a little while.
Okay, seeing no more questions, we'll wrap it up for the day. We are planning another media briefing about COVID-19 vaccine at 2:30 p.m. Mountain Time, Tuesday, March 23rd. Watch for those details on Monday. I want to also let you know that our weekly Facebook Live video tomorrow will feature Deputy Director Laura Wolf, who will be speaking about the state's pre-registration tool for vaccine appointments. So be sure to tune in, and thank you all for joining us today.
Zach, can I get in one more quick question?
Sure, go ahead.
Sorry about that. Rose that hand pretty late there, but just wanted to ask quickly, not on the vaccine, but just about have you guys been noticing a rise in COVID variants lately as we do see cases slightly pick up in the last week or so? Is this still a concern?
It's a great last question, Joey. And I'm actually going to let Dr. Hahn start into this. And we also have Dr. Ball available.
Yeah, thank you, Elke. I was surprised nobody had asked about the variants, so thanks for squeaking that in. Yeah, we are very, of course, with great interest following the variants. And that's why we actually asked Dr. Ball to join us today. I forgot to tell Zach in time for him to be introduced, but he is going to talk a little bit about the work that the state lab is doing. We are detecting some variants, but our information is new and it's hard for us to talk about trends yet. But I'll turn it over to Dr. Ball if he can kind of talk about the work they're doing and what they are learning.
Great, thanks, Dr. Hahn. Just a couple of quick notes on our sequencing program. I think it's very important to note that it is very early on in this program development. So we've only been sequencing samples for approximately 3 to 4 weeks. We have done a fair piece of outreach with clinical laboratories around the state and encouraged them to send us samples on a regular basis, up to 5 PCR positive samples per week for those laboratories that are performing tests that are suitable for sequencing. That being said, the sequence data is rapidly coming in. There are multiple laboratories outside of the Idaho Bureau of Laboratories that are performing sequencing on samples from Idaho. We're currently approaching about 400 samples being sequenced, and we'll be updating those numbers on the coronavirus website on Thursday evening at 5 o'clock. We have seen a few variants of concern. And those numbers are slightly rising, particularly with the variant of concern that was first identified in the UK. I think part of the reason why we're seeing that increase is that there is an ability to screen for that. So there is a particular PCR signature that we can identify that may indicate that variant is present. And so we've been working with laboratories that can perform that test to send those in to us. So I think when you look at our sequencing data across the board, what you're seeing is it's not representative of what's happening in the state. We are definitely oversampling for particular things, those being variants of concern predominantly, but also looking for potential vaccine escape cases or potential reinfections. And so the data is growing. There's really not enough of it yet on a wide scale basis for us to make a lot of conclusions about trends, but we're hoping as we continue getting more sequencing data in that we'll be developing some ways to visualize and report out that data in aggregate in the coming weeks. I'm not sure if that answers your question.
Yes, thank you.
Okay, well now we'll actually end the briefing. So thanks again, everyone.
Thank you.